Your big toe is throbbing, red, and hot. You can barely put a sock on it, never mind a shoe. Does that sound familiar? Well, let's talk about gout because it isn't just for Victorian kings. Last week, I saw a man in his 40s. Let's call him Dave, a fictitious name. Dave's a vegetarian. He occasionally has the odd bit of chicken. He's generally healthy, doesn't drink alcohol at all. But 10 days ago, his right toe started really screaming at him. It was painful, hot, and swollen. He hadn't injured it, not stopped it. Dave was sent for an x-ray which came back normal, showing no fracture. So what was it? It was actually Dave's first attack of gout. And Dave was really shocked because he thought gout was just for meat eaters and heavy drinkers. That was definitely a myth busted. So how do you spot gout? Well, there are 4 things you should generally look for. First, sudden pain in the affected joint that often wakes you up at night. Secondly, the big toe is the classic joint, but other joints like the ankle, knee, and elbows or wrists may also be affected. Thirdly, the skin over the joint feels shiny, looks very hot, very tender, so hot that it feels like the joint is on fire. Very often you can't even bear the weight of a bedsheet on it. That's how tender it can be. If that sounds like you, then keep watching. So what is gout? Gout is an acute inflammation of a joint causing it to become very swollen, very painful, very hot as a result of a buildup of uric acid crystals in the joint. Most gout can be managed by your GP in the community. However, there are important red flags to consider, and if you have any of these, you must call 999, 111 or go directly to accident and emergency. Firstly, if you develop fever, chills with the joint pain, then it could actually be an infection, something called septic arthritis rather than gout. Secondly, if you develop pain and swelling in multiple joints or more than one joint, then it's very unusual that this is gout. You may have an inflammatory arthritis such as rheumatoid arthritis. Thirdly, if you have a hot, swollen, painful joint with a cut over that joint, then you've got to seek urgent medical advice because an infection may have seeped through the wound and got into the joint, again causing septic arthritis. Finally, if what you think is gout is so much more painful than any previous gout attacks that you've had, then you've got to think again, is this really gout or is it something else? Fortunately for our patient Dave, he had none of these red flag symptoms and we could manage it safely in the community. So let's talk about the management of gout. Importantly, there are a lot of things that you can do yourself to help manage gout. You want to take the weight off your foot, so rest is very important. Elevate the affected joint, often the big toe, on a pillow or footstool. Ice compress in the form of ice packs or frozen peas can be extremely helpful. But remember, don't apply the ice directly to the skin to avoid burning the skin. Wrap it around a flannel, a towel, or very thick hand paper towel. And you've got to stay well hydrated. Drink plenty of water, especially in very hot weathers. What about medication? Over-the-counter non-steroidal medications like ibuprofen or Nurofen, the same thing, can be very helpful. But only take these if you don't have any stomach issues like acid reflux, indigestion, or stomach ulcers, or if you don't have any kidney problems. So please check with a pharmacist if it's safe for you to take it. Your GP, we can also prescribe stronger non-steroidal anti-inflammatory medications such as naproxen, or if necessary, diclofenac, also known as Voltarol, if required. If, because of other medical problems, it is unsafe to take non-steroidal medications, we may sometimes prescribe something called colchicine or a steroid medication. But please do not buy these over the counter or online. You should only get these from a licensed medical professional. In Dave's case, he took ibuprofen and within 48 hours his symptoms were significantly better. Is there a role for surgery? I can say almost never really in acute gout, especially in the first few instances of gout. There may, in very rare instances, if someone has chronic unremitting gout whereby they develop significant tophi under the skin and over the joints, they may sometimes do surgery to remove those tophis. But this is a very, very rarely done procedure nowadays. So here is your takeaway. To arm you with something that you can use to be a master of your health. Gout is a wake-up call and not a life sentence. Even if you're a vegetarian like Dave, you can still develop gout. That is because your body still makes uric acid. And if there's an overproduction of uric acid or there's a problem with excreting uric acid in your kidneys, you get a surplus of uric acid in your bloodstream, in your circulation. Your body can still make uric acid from natural proteins. But you can take control of it. Keep well hydrated, rest the affected joint, and know your triggers. For some people, it's alcohol. For others, it's seafood. For others, it's red meat. Know your triggers and avoid or minimize them significantly. For Dave, we'll be checking his uric in about 4 to 6 weeks' time. And depending on the levels, we may discuss pros and cons of long-term prevention. This often requires taking a medication called Allopurinol to suppress the amount of uric acid in the bloodstream. Now look, Dave managed his gout and so can you. Until next time, be a master of your health, one toe at a time, one joint at a time. This is Doctor to you. See you in the next video. If you haven't already subscribed, please click that subscribe, click the notification bell. It helps other people like you get this valid information.